Hi, and good afternoon, everybody. Dr. Ken Muich, Stetson Chiropractic Clinic, Fibromyalgia Wellness Center. We're going to be covering another subject today, mainly concerning, as we have over the last couple of weeks, the frustration of the multiple symptoms that fibromyalgia patients have. This might also be worthwhile for people that are just having general aches and pains and health problems that need to know where these symptoms are actually come from, and actually if you've been diagnosed correctly. So we're going to be talking about something in the stomach area today. The inflammatory bowel disease, the celiac disease, excuse me, and irritable bowel syndrome. And all these three have very, very similar symptoms, as a matter of fact, but they are different in itself. Let's take a look at the inflammatory bowel disease, which involves actually maybe two different conditions in itself. One is ulcerative colitis, and the other one is Crohn's disease. We're going to be talking about the symptoms in just a moment that are similar in all three of these cases. This has to do with the digestive tract. And obviously the pains and health and the symptoms themselves are very, very interesting. There's no test for this. It's what's called an exclusionary or elimination type of diagnosis. When nothing else shows up, then this is it. Sounds familiar to fibromyalgia, doesn't it? Well, all three of these are very, very similar as far as symptoms to fibromyalgia also, so that's why I thought we would talk about these. Again, this has to do with the digestive area of the stomach itself in general, so to speak. Then the other one is the irritable bowel syndrome. This is very, very interesting because it's very, very difficult to diagnose because you have to have at least 3 days, of which 6 months of symptoms in 3 days per week for 3 months where you actually have these symptoms. So think about it. We're talking at least 6 months or longer before this has been actually diagnosed properly. It has to do with the large intestine, this condition, the irritable bowel syndrome. And again, it's very, very difficult. This is one of those elimination things, diagnosis by elimination or exclusion, where you have to look at everything else and then finally, oh, okay, well, it must be this. But again, it could be a condition where it could be the inflammatory bowel disease itself versus the irritable bowel syndrome. The third one is the celiac disease. This is kind of interesting because of the, again, confusion with this condition. The celiac disease, of which I found my daughters are they all are different, obviously, but one of them actually has a celiac disease, and I kept on telling her what she had, but why listen to Dad? And so consequently it took a little while, but very, very interesting. Celiac disease can take as long as 10 years to diagnose properly. But if you've ever had a patient that has had celiac disease, definitely it won't take that much time. Now they have a couple of tests. They have a blood test and also and something called endoscopy, an endoscopy test to actually find out whether or not this individual has celiac disease. It is involved with the small intestine. So you have the inflammatory bowel disease, which is the general digestive tract. You have the irritable bowel syndrome, which is the large intestine, and then you have celiac, which is small intestine. Now, the celiac or small intestine has all of these very, very small fingers, the trillions of them inside your intestine, and what they do is the foods go in between these, and then they're digested properly. But with a celiac disease, they're very, very short, and so they don't have these large villi, so to speak, of which the food can get in to get processed properly. And so what you have is an individual, and they think this is an autoimmune disease, genetic, that an individual has. So in other words, you're born with this, which you have sensitivity to something called gliadin. Gliadin is part of the protein, the gluten protein. And so it affects people that usually eat wheat, rye, barley, malt, or some oats. And many times it'll cause a lot of the symptoms. For some people, it doesn't. It's just a very slow-acting type of thing. That's why it takes sometimes years to actually diagnose this, because some of these conditions actually wax and wane. They come and go and so forth and so on. The most common of the symptoms of these, and all of these are fibromyalgia patients, believe it or not, have these. Diarrhea, you could actually have a combination of diarrhea and or constipation on these, which is very, very interesting. Fatigue, you can have abdominal pain, gas, bloating, weight loss, and cramping. All of those, again, are symptoms that are found with fibromyalgia patients if they have anything to do with the intestines. And this is very, very common for fibromyalgia patients where they have a problem as far as digestion is concerned. So if this sounds familiar to you, you may have fibromyalgia, but you also may have one of these conditions. Again, the inflammatory bowel, the irritable bowel, or celiac. And so you should have this checked to help differentiate, to make sure that you know the differences between these. So again, you can have diarrhea and or constipation. You can have fatigue. How common is that with fibromyalgia patients? For some of these conditions, you can actually have joint pain, which is very, very interesting. If you have fibromyalgia, who doesn't have joint pain? You can have cramping and bloating and gas. Again, all of those things can be found with fibromyalgia patients, and weight loss, which is, again, a problem. Now, a lot of fibromyalgia patients may be the same weight as they were last year, but because of pain and all the symptoms that they have, they can't exercise. And so consequently, the lean tissue, and I've talked about this before, their lean tissue turns into fat. And so the percentage of fat tissue is a lot higher than lean tissue. And fat is inflammatory. So that's another problem that you have to deal with. So again, there's, as I mentioned, there's 15 conditions, and we're going to cover these, that have symptoms that are similar to fibromyalgia. And that's why, again, fibromyalgia is so difficult to diagnose. That's also why, as I mentioned to you, the inflammatory bowel disease, the irritable bowel, the celiac diseases, all of these are difficult to diagnose, and many of them are done by, like I say, exclusion, where nothing else fits, and say, oh, okay, well, we might as well check into this and see if it might be an inflammatory bowel or irritable bowel. Or again, celiac is a little bit more easily diagnosed just because of the sensitivity to the gluten products. Now, it's very interesting because I've had patients that go to Europe and other locations outside the United States, and they'll have wheat, rye, barley, malt, whatever, and they will not have any symptoms. Very, very interesting. So it must be things like the gluten that they're adding to the bread or to the products to obviously cause this reaction. Are there other symptoms that you may have reaction-wise? Yes. I'm just talking about those that are most commonly found as far as fibromyalgia and those that match with fibromyalgia in itself. So you may have some other symptoms, bloody stools, for example, a variety of other things that you may have that may not fit as far as fibromyalgia. But let's look at the overall picture. See, that's the problem with a lot of doctors is they scope in on a certain thing and they can't actually see anything else. These are chronic conditions we're talking about. The inflammatory and irritable bowel and celiac. These are chronic. Okay, they are something that just keeps on producing all of these bad things for you. So are they, again, fibromyalgia? Are they individual products? You can have fibromyalgia and these other conditions, okay? And keep in mind, as I've always said over and over, fibromyalgia invariably will make these other conditions more irritating and worse. And so when you have it, the most common reactions that we have, these flare-ups are killing me, these flare-ups are killing me. What are you doing? What are you doing to be able to help yourself? Now, in many of these areas, we're talking about, in many of these conditions, like I just mentioned, stress is really an important aspect. Yeah, I understand. Stress, anxiety, depression, those are real common with fibromyalgia patients. But what you want to do is find some quiet time, see if you can actually relax a little bit, get out of the pain mode if you can, If there's something that you can take that'll minimize or reduce the pain, even if it has to do with something that might not fit into your protocol, sure, take it, at least during these flare-up periods. But stress is very, very important. Dietary, again. Are you eating foods that are inflammatory? Sugar, gluten, trans fatty acids, dairy, all of those can be found to be inflammatory in one form or another. Are they all inflammatory to you? No, probably not. I hope not anyway. But I'm sure that if you get off of sugar, gluten, trans fatty acids, and dairy, that some of those are causing your flare-ups and your reaction. And again, I've talked about things like weather changes, okay? I talked to my family back in Illinois, and I can't believe how cold and rainy it is. They're having crazy things going on. East Coast, what was it, a week or two ago? They had snowstorms, my goodness, in May. So there's a lot of things that can adversely affect fibromyalgia patients. And one of them, obviously, is weather, along with the differences in weather changes, hot versus cold. I've always mentioned Arizona is probably one of the better places because we only have two weathers, extreme heat and moderate. It's rare that we have something that is different from that. It's rare that we have a lot of rain. It's rare that we have a lot of wind, so to speak. Now, up in the northern country of Arizona, sure, they're going to have some of those things. They're going to have 4 seasons. But in the Phoenix metropolitan area, most of the time the temperatures are either very hot or moderate, which is easier for fibromyalgia patients to adapt to in itself. So, stress, diet, okay, a variety of other things, including the weather changes and so forth. So there's reasons why you have flare-ups. We're going to be talking about those 15 conditions that have matching or mixed symptoms like fibromyalgia. And so that's why when you go to a doctor, you have to tell them all of your symptoms, not just those that you're having for that day, okay? Some of these conditions I talked about today produce also headaches, okay? But not all of them, okay? You'll have more headaches in celiac disease and the irritable bowel than you will in the inflammatory bowel disease in itself. But again, keep in mind, look at the overall picture, okay? Make sure your doctor looks at all of the different aspects of the aches and pains. Keep a diary. Keep a diary for food. Keep a diary for your flare-ups and your symptoms, okay? You get a pretty good idea as far as many times you'll have flare-ups. I'll have patients say, yeah, every about 2.5, 3 weeks I'll have a flare-up. And it could be regardless of what they're eating, what they're taking care of, so forth and so on. So we try to find out what's happening during that third week or 2.5 weeks or whatever else before they have a flare-up. You can do the same thing, but you have to keep a diary if you're interested in giving yourself an opportunity to have a life and enjoy it. So keep that in mind. Keep all those things in mind. We're going to be talking about all the rest of these conditions in the near future. Next week, because it's Memorial Day, I will not be doing any live broadcast itself. I will be doing a live broadcast the following week, but expect to get messages from me concerning fibromyalgia and many of the other aspects in itself that we have concerning fibromyalgia and the other conditions, so to speak. I just had a message come in that 35 different people are actually participating in this. That's great. And when we have this, hey, listen, I'll be sending out information to you. Let your family and friends, neighbors, doctors know of our talks. They can go back and, like yourself, and check. This is the live video presentation 115. So I've done 115 live video presentations. Most of them have been saved either on Facebook. You can look back, and many of them are on YouTube in itself. So I want to thank each and every one of you. Yep, it's time. I try to do 15, 20 minutes. Try not to go anywhere past that. Now, one last thing. One word about COVID-19 again. Look, this is not over with. Make sure you protect yourself. If you have fibromyalgia or other conditions, you're more highly susceptible to pick up this virus than anybody else that may be healthier. Keep in mind that they're looking for hosts. This is a virus, okay? And it's looking for hosts. And you're a host, okay? Like, come on in. No, you don't want that, okay? So you want to make sure you do things. You want to wear the mask, okay? You want to keep yourself clean. You want to make sure you take care and keep track of those people who you're involved with, so to speak, directly. Keep your distance from each other. You know, you could fit 1 million of these viruses on the head of a pin. That's how small they are. Not like bacteria, okay? You need special spectroscopy to actually see viruses in itself, all right? So that's very, very important, that these viruses, they're so small, it can be easily picked up by communication with each other, touching, so forth, and so on. If you're going to go out, you know, I'm seeing these people in restaurants without any masks on, everything else. It's just very disconcerting for me that people do not have control over their destinies, so to speak. They really don't seem as though they're disciplined. They don't really care, not only about themselves, but also their family members. They might bring this home to. I don't know how they're going to deal with the school children. I'm deathly afraid of that because they have not found an answer for this virus. And it's changing, it's mutating faster than our science can actually get control of it. Sure, they can take care of the symptoms. It looks like they're getting more and more things. But as far as the control of the virus, not yet, okay? They're talking about, again, maybe 6, 8 months, maybe a year, okay? I know our government's talking about end of year. I don't think they can do the proper testing. Now, they've done this before with H1N1 and some other ones where they actually thought that something would work, and they started feeding it to people, and a lot of people died. And actually, the lawsuits, if you can look up, I think it was H1N1, had a number of lawsuits because they actually had an answer, so to speak, but it affected a lot of people, almost like a polio aspect, and a lot of people died. So make sure you take care of yourself, protect yourself, and I will see you in a couple of weeks. I'll be sending information out to you. Thank you so very, very much. Have a great week. Have a wonderful Memorial Day holiday, and look forward to seeing you soon. Bye-bye.